Prednisone more than doubles your risk for diabetes. A brand new study came out in September 2024, and it shows you're 2.6 times more likely to get diabetes if you take prednisone. And if you've been on prednisone for years, this gets even more serious. I got a comment questioning, hey, I've been on prednisone since 2009. I'm dealing with high blood sugar. And honestly, that's exactly what this research predicts would happen. I'm Dr. Megan, the prednisone pharmacist, and today we're talking about prednisone and diabetes, why it happens, what the science says, and most importantly, what you can do about it. So why does prednisone raise blood sugar? Let's break this down in simple terms. Prednisone does two really annoying things when it comes to your cells and blood sugar. First, it makes your cells stubborn. Your cells stop listening to insulin as well as they should. Kind of like my teenagers. It's like insulin's knocking on the door saying, hey, let us in. And the cell's saying, nah, we're good. We don't need blood sugar. That's called insulin resistance, or having a teenager. Second, prednisone messes with how your cells actually absorb glucose. That's the sugar in your blood. So even when insulin does get the door open, the sugar has a harder time getting in and going where it belongs. The result is sugar just hangs out in your bloodstream. And your blood sugar goes up and up and up, and sometimes way up. So this study looked at over 450,000 people between 2013 and 2023. None of them had diabetes at the start. But here's what happened. Of those 450,000 people, about 4% of them ended up taking steroids like prednisone, hydrocortisone, dexamethasone, methylprednisolone during their hospital stay. Of those people, 2% developed type 2 diabetes. Compare that to the people who didn't have to take steroids, less than 1% got diabetes. If you do the math, that's a 2.6 times higher risk. That's more than double, folks. You know, prednisone is like that friend who helps you move in, but then eats all your pizza and breaks your lamp. Yeah, it's helping your sarcoidosis, your asthma, your PMR or whatever, but it's also in the background doubling your risk for diabetes. Very classy, prednisone. So what can you do about it? Now here's where it gets interesting. And I want to talk about something called chromium. There's a study from 1999, and they studied what does prednisone and chromium have to do with each other? Here's what they found. When people take steroids like prednisone, their bodies lose more chromium in the urine. Before steroids, people were losing about 155 nanograms of chromium per day in the urine. After steroids, that number jumped to 244 nanograms per day. That's about 60% more chromium that's just gone. Why does this matter? Because chromium helps your body use insulin better. When you're low on chromium, your blood sugar gets worse. So these researchers gave the patients 600 micrograms of chromium picolinate each day, one with each meal, one dose of 200 micrograms at each meal. And guess what? Their fasting blood sugar dropped from 250 milligrams per deciliter down to under 150 milligrams per deciliter. They were in the dangerous zone of blood sugar levels and back closer to the normal levels. They were also able to cut their diabetes medication need in half. That is pretty dramatic. So what should you do? Number one, if you're like my viewer who's been on prednisone long-term since 2009, then you need to be getting your blood sugar checked regularly. I'm talking A1C tests, fasting glucose, the works. Your doctor should already be monitoring this, but if they're not, speak up, advocate for yourself. This research shows that they should be. Number two, talk to your doctor or pharmacist about chromium supplementation. The dose used in that study was 200 micrograms each dose, and I included that exact dose in Nutrinized Zone. Number three, do everything that you can to keep your blood sugar under control. This means watching your carbs and your sugar intake, getting regular exercise if your condition allows it, staying at a healthy weight. I know, super hard while on prednisone, right? And monitor your blood sugar at home if your doctor recommends it. Some people get continuous glucose monitors. Finally, work with your doctor to get on the lowest effective dose of prednisone or whatever steroid you're taking that works for you for your condition. I know that's easier said than done, but the lowest effective dose for the shortest period of time possible is the best guidance when it comes to prednisone. Drop a comment below if you're struggling with blood sugar on prednisone. Let's support each other. And if you want Nutrinize Zone to help you to support your blood sugar, to support other side effects that prednisone causes, you can get this by clicking the link below. Signing off as Dr. Megan, your prednisone pharmacist.